Again, a question from a pregnant woman. Why is it important to see the dentist after giving birth? So after giving birth, that sounds like we have two people we're talking about now, but certainly for the moms, what are we saying here?
Now, you may think that now the baby's out of my body, I don't need to control my diet or my hygiene anymore. But bacteria can still be transmitted to the baby. Same thing with prevention, the knowledge of simply avoiding to share food with the baby, kissing directly right on the mouth, that can transmit bacteria. And that's where that appointment, the 2-month appointment, is important. And it's mostly for mommy, for her to gain that knowledge, right? Because there's no point in talking about it too early, because then it's not relevant to her, and then she may forget.
And her mind's on other things. So,
yes.
Right.
So at that point, that's where we can show mommy how to clean baby's gums. And most mothers don't know that you have to do that, but the benefit of doing wiping the gums is that we're removing bacteria. That's the number one reason. Number two is that with the slight pressure, we are stimulating the gums and teething. Okay, and also taking care of mommy's teeth is important, because if mommy's teeth are healthy, then there's less chance of transmitting. And plus, for example, if mommy wasn't healthy because of pain or whatnot, she would not be physically fit to take care of her baby, because it's very demanding. You're losing sleep, waking up for nursing and all that. And for the baby, it's important as well, because we can detect small problems such as tissue problems, or like the tongue can sometimes be tied down to the floor of the mouth, and it can affect latch.
It seems to me as well that you recommend no X-rays for about a year. Is that correct for mom? Well, is that for mom, for baby?
No, it's for both, because obviously during the pregnancy we avoid X-rays, right? Now, after when the 2-month appointment is a good time for X-rays, because now it's been over a year that mommy hasn't had X-rays.
I see. Okay.
And things can develop because of changes in the diet and the hygiene. And it's like when you're getting braces and they come off, it's a good time to come in for X-rays, because little things can develop, and then that's where we can detect them and fix them early. Because if there is a cavity that develops into a bigger problem, and then mommy is not at her best, then she won't be able to take care of baby.
I guess the short answer as well here is, let's get mom back on track to where she would have been
for sure,
if she had just stayed right on that dental health program.
Yes.
Very good.
Yeah, so Dr. Julie, it sounds like there is so much that you have to kind of take into consideration that it can be kind of overwhelming. So this notion of getting back on track makes a lot of sense. Anything to add to that?
Well, mommy's always known to take care of herself last, right? So, and that's why we have it there. So it's a reminder for her to take care of her teeth, so she can also take care of her baby. When baby's born, actually, baby doesn't have any bacteria that are causing cavities in her mouth, and they acquire that later on. And who's the first person that they get it from? It's mommy.
Okay, so mom taking care of any bacteria she has is actually about preventing illness in her child.
This is how our baby gets, the bacteria most of the time. So we want to make sure that our mouth is in top health as well, because I mean, as much as we tell the moms not to share the food, not to lick the spoon,
it happens a little bit, right?
It happens. We kiss them on the lips, like close to the lips, and we do pass it on.
We're not focused on bacteria at that point, right?
But that's why it's so important, because by taking care of herself, again, we're taking care of a baby long term.
Well, that's the bottom line, right? Yeah. Okay.